Hello, for this discussion, I will be portraying a pre-encounter team member, and I'll be discussing this fishbone diagram, which is used to display the process that's used to track and collect revenue from patients. And it begins with, over here, with scheduling the appointment, and it follows the process all the way through to final payment over here. So one way that we can improve the amount of payments that's being received is to put the patient at the center of the process. And by doing this, we can recognize the need for the patient, improve their satisfaction, build relationships. You can even give like verbal or written explanations regarding their financial responsibility, payment options, and really just what to expect from their visit. We all know, if we've ever dealt with any kind of insurance claims, especially through healthcare, it can be very confusing on what part your insurance will pay for, what part is the patient responsibility. Do we need to get procedures pre-authorized or not, things like that. So I think just clarifying that whole process would definitely help with improving the revenue. Investing in technology would also be another way. It seems like Medicare and Medicaid, really any insurance, like to automatically deny every claim to make you resubmit the claim again, and I think frustrate people to make them just give up and just pay it out of pocket. But it costs time to investigate unpaid claims and correct mistakes and resubmit them. So if you would implement automated software, you can streamline the process with prior authorizations, eligibility, medical coding, and billing alerts, and things of that nature. Would help cut down on the amount of time the staff uses towards those things. Collecting patient financial responsibility before services are rendered, which I think most of your doctor's offices and healthcare facilities already do that pretty much. It really slows things down when the patient responsibility is late or underpaid, and hospitals run the risk of never receiving full payment for services, and additional staff will be needed to follow up with the patients and collect. So if you can optimize patient collections by collecting deductibles or presenting a payment plan options before services are rendered, you increase your likelihood of getting the full payment. Automating the process of prior authorizations and eligibility would help also increase the revenue. Automating prior authorizations and eligibility can help optimize the clinical process, speed up revenue, and reduce the time that the staff would spend on the task. Improving the charge capture and coding is important for hospital healthcare practices to develop, because common areas experience of lost revenue are outpatient nursing procedures, IV therapy, injections. Those other areas too besides those, but missing charges on errors and reporting too create a loss in revenue, which obviously with the high healthcare costs, you need to get every dollar in you can. Just management of denials. If you do all these things that not only I've listed, but there's a million other things, but if you do those things, you result in less denied claims, which ultimately generates more revenue. Denials prevention should be implemented for the entire staff to focus on, so that everyone's on the same page to mitigate denials. And the best practice management can increase cash flow and reduce the volume of denials and increase the collection rate. That's all. Thank you.